Good afternoon. My name is Naomi Jenkins. I'm a physician assistant student at Bay Path University. I'm here today presenting on unlocking improved patient outcomes via user-based technology. Let's get started. Public connectivity and reachability are at an all-time high, driven by the 6-inch mobile device that 90% of Americans own. And within just a swipe or tap, we have vast capabilities at our fingertips. One of the most prominent access points of reaching individuals and patients that we'll discuss heavily today will be through personal mobile devices. These interfaces are designed to allow healthcare providers or other service providers to communicate directly to patients in order to tailor services. User-based technology is specifically designed interfaces with uh, patient-facing options, allowing for intuitive functionality, easy usability, and that really meets our patients' needs and expectations when managing their health. So let's imagine a world where a patient can take daily inventory of their symptoms or receive instant feedback from their care team. If they could immediately adjust a very titratable medication in real time through self-monitoring apps and data that they are inputting from the comfort of their own home. They're placing autonomy back in the hands of our patient and some ownership over their own chronic medical conditions. We can integrate this approach and revolutionize healthcare and improve our patients' outcomes. This is one of the keys to unlocking longevity and extended quality of life would be through empowering patients to take ownership of their health. This means reducing risk factors, staying compliant with treatment plans, and committing to daily health goals, um, which are all goals of integrating user-based technology. So user-based technology can vary from apps in the smartphone to wearable watches or devices that could track heart rate or glucose levels, um, and allow decision-making, real-time feedback, and can be a potential game changer in healthcare. Technology isn't a new concept. We use electronic medical record taking for charting on patients, um, which was more focused on provider efficiency rather than patient experience. But in the book, Bringing User Experience to Healthcare, authors Bates and Roberts emphasize the importance of prioritizing the patient's experience when designing healthcare technology, and they argue that we should be creating experiences, not just systems and processes, and that patient-centered approach is driving the next wave of technological innovation in healthcare. So this presentation aims to examine technology's impact on patient outcomes, including health informatics, which is data points, through emergency response or medical management, and through taking a look at future trends benefiting patients' health outcomes. So first, I want to take a look at Parkinson's disease management and where we can integrate user-based technology. Parkinson's is a neurological motor movement disorder, um, which comes along with many symptoms. Um, and so through the Movement Disorder Task Force Society, the Society of Task Force on Technology, they took a look at the potential to improve symptom monitoring and tailoring therapy. So they came up with electronic journaling of symptoms, as well as wearable devices that are able to uh, objectively look at tremor, rigidity, slow, limited movement, which is bradykinesia, sleep dysregulation, and cognitive impairment, and able to correlate and adjust timing of medications and further personalize their therapy. Their research conducted through the Michael J. Fox Foundation looked at data gathered from 10,000 patients, and it's also able to really identify where, through the electronic journaling, where patients are really feeling their symptoms, and allowing us to target um, the most impairing daily symptom that the patient themselves is subjectively reporting. This allows clinical applications, extending into clinical trials. Parkinson's patients have a lot of performance bias. So being able to assess patients in their natural environment and obtain that data, we would be able to extend onto general, population health as well. Similarly, digital initiatives have taken on type 2 diabetes and other chronic diseases, and they've shown some remarkable results in this study titled Digital Health Coaching for Type 2 Diabetes. They conducted a randomized control trial with the intervention group implementing a digital coaching platform. And this provided two-way text messaging as well as weekly phone calls. And the intervention group saw a reduction in the hemoglobin A1C, which is the most prominent metric used to assess the how well controlled someone's blood sugars are, as well as saw remarkable weight loss and reduced systolic blood pressure. Something that was really notable was that the only intervention was increased communication and accountability. There was no change in diet, no change in medications, and no change in physical activity that the study was promoting. And so I think this really highlights the simple communication that can be facilitated through mobile devices, which can yield significant health benefits. Another aspect is that it can reduce socioeconomic constraints and cost for insurance companies. And so the Healthy at Home project projected overhead cost per patient of $270, whereas currently the most standard diabetes program is the diabetes prevention program, which costs about $500 per patient. And as I mentioned, the advantages of the digital health coaching are real-time feedback, tracking, and immediate response to glucose levels. So as you saw in the previous slide, you can text what your blood sugar was that morning, and they give you a green light or a yellow light, and provide you some additional information about how your sugars were looking that week. It addresses the barriers of lack of reporting and monitoring their blood sugar, poor patient compliance, as well as costly in-person appointments. All right. You may have expected me to discuss telemedicine, which is a huge part of user-based technology and the advancement and integration of technology in our modern day health system. And so telemedicine really means healing at a distance. It's been around for over a century. In 1925, when a New York doctor used a telephone to discuss the EKG with their patient in Nebraska, which mimics our modern day telemedicine as we know it. A comprehensive review of 93 trials comparing telemedicine to face-to-face found that telemedicine provided similar, or if not superior, outcomes for conditions such as cardiovascular disease, diabetes, mental health disorders, substance abuse, compared to real-time face-to-face face-to-face appointments. The ability to have virtual medical appointments really does eliminate the common barriers such as lack of transportation, time constraints, and the socioeconomic limitations. And so by reducing these barriers, telemedicine promotes healthcare equity and also improves adherence by the patients. All right. One of the most compelling advantages of user-based technology is the potential to enhance emergency response. This is the chain of survival, which was coined by the American Heart Association. And it's a framework that emphasizes the importance of early intervention in a acute emergent cardiovascular cardiac arrest. And as we know, time is um, time is muscle. So we really focus on coronary reperfusion, putting blood flow back to the heart, which is a huge step in patient outcomes for this. Um, and so in that case, we can use user-based technology in order to make the transition before paramedics arrive and the measures that are taken before there as efficient as possible, as timely as possible. So mobile applications can now provide real-time CPR instructions. They can ensure bystanders deliver high-quality chest compressions or explain or show how to do them via video before emergency personnel arrive. Heart disease is the leading cause of death in the United States and is an area where early intervention is critical. The American Heart Association does recognize the role of digital strategies in improving emergency care. I looked at a few different studies just to highlight the real-time CPR assistance apps, such as Pocket CPR and Me CPR. Um, they incorporate real-time visual feedback as well as auditory coaching through CPR, and they have found that there is improved confidence in those who are administering CPR, which has a measurable impact on outcome, but there's clear benefit. There are also sensors that can provide motion sensing quality feedback regarding the rate of the compressions or the depth and the quality of the compressions, uh, which can allow for real in-time adjustments. A study in Sweden looked at a app that would alert CPR trained individuals if there was a cardiac arrest nearby, and those results revealed 62% increase in CPR initiation out in the field. In the fields, meaning not in the hospital, but just out in the public. A study coming out of Japan looked at a AED locating app, which improved the accessibility and the which directed bystanders to the nearest AED using GPS. And this intervention significantly increased the amount of AEDs that were utilized before emergency personnel arrived. So these interventions really complement the American Heart Association's call to action that we need to implore forward-thinking technological pathways in order to combat one of the most high cost, the highest cost of death, which is cardiovascular disease in the United States. An interesting development since the start of this research topic came out in February 27th that that telehealth for older adults on Medicare is being threatened. If Congress does not renew the current laws that were established in 2020, those who seek telehealth via Medicare are at risk for reduced or no coverage, which would be severely detrimental. Um, and in the article, one provider commented that half of her patients seek telehealth for something such as simple information like receiving lab results. And she fears that patients now will miss necessary appointments if they require in-person visits. And this would have detrimental impacts on their chronic conditions as they continue to worsen. So Congress should rule by April 1st, and I would hope that they rule in favor of continuing telehealth legislation and restoring that in order to improve um, our patient health outcomes. So the future of healthcare technology, we must be prioritizing inclusivity. Digital health solutions must be designed with accessibility in mind, thinking of older adults, minorities, those with cognitive impairments, digital literacy, socioeconomic factors, to ensure that all patients can benefit from these examples, from these advancements. Ultimately, improving patient outcomes does not require billions of dollars of research or new cures or miracles. Instead, we can capitalize on existing technology in order to optimize preventative care, streamline management, create individual care plans, increase communication, and enhance emergency response time for cardiovascular disease. And through embracing these advancements, we have the power to create a more equitable healthcare system, one where technology bridges gaps between patients and providers, reducing mortality rates and improving quality of life. And so with that, I thank you for tuning into my presentation.